Well, government says it can now ramp up weekend vaccinations now that it's secured more funding. President Cyril Ramaphosa wants at least 300,000 vaccinations done daily. The private sector in Gauteng has been at the forefront, administering vaccinations at the weekend at some sites. Well, Heidi Giokos is on the ground for us, taking a look at one of the private discovery sites. She's checking on how things are going. Heidi, a very good afternoon to you. And I suppose the over 50s are out and about, taking their opportunities this weekend. What have they been telling you? What's happening in those queues, or are there actually queues?
Yes, indeed, Yuvika. We've been here since early this morning, and we've seen many people coming in, 50 and above, as well as 60 and above. Many of them getting their second doses of the Pfizer vaccine. And of course, we do understand that private vaccination sites, such as this one at Discovery, have decided to increase their working hours and allow for vaccinations to take place over the weekend. This, of course, is going to make a huge and a significant difference in how many people get to the vaccination sites, because many people can't get to vaccination sites during the week, especially if they are 60 and above. Many of them aren't in a position to get to vaccination sites, and it just makes it a lot easier when they are able to be scheduled or booked over the weekend. And we do know that the Department of Health is trying to increase the vaccination drive, especially on weekends, as there's been an outcry to say there are just not enough vaccinations administered over the weekend. We got a chance to speak to some people a little earlier on who have spoken about the significance and importance of course, getting the vaccine and how effective it is against severe COVID-19, especially with the Delta variant driving the third wave in the country. But let's listen to what a few people had to say with regards to the importance of getting the vaccine and the convenience of getting it over the weekend.
It's just convenient because I don't work on a Saturday. So that's why I took Saturday, because during the weekend it's chock-a-block for me. So it was convenient.
It is quite convenient because it allowed me to do my work during the week and to come here and do the vaccine. And I think it was seamless as well, just coming in, registering the team. They were quite assuring, because I think one is a bit anxious. So I really enjoyed my experience. And the layer of protection, I think one needs that, but also psychologically you need that safety of understanding that you're vaccinated. So I'm really, really proud to have been here. And I'm hoping that more South Africans can do it.
It's so important to everybody, and especially to the elderly, and I'm very pleased that they looked after us first.
It's necessary for us to have a vaccine, because we have so many variants now, and then this thing, I think, is going to be with us for a long time. So let's vaccinate and make sure we can go on with our lives, go to work and do things that we normally do, but we must still wear a mask and observe all those other things that we need to observe all the time.
Well, Heidi, it seems those who are there are certainly enthusiastic about it. But, just about a week ago, we were still talking and worrying about vaccine hesitancy. I think those thousands of teachers were a big concern. That's what we were talking about last week. But in terms of that, are we seeing that slowly dissipate? Are we seeing more and more South Africans getting on board?
It seems as though studies are showing that more and more South Africans are willing to get the COVID-19 vaccine, Yuvika. And while many people argue that you can still get COVID-19 even though you have been vaccinated either with Pfizer or Johnson & Johnson or whatever vaccine is being administered, the big issue and what everyone needs to remember is the fact that it protects from severe COVID-19 and hospitalization, which is, of course, what many governments around the world are trying to avoid, to say if we can minimize the pressure on the healthcare system, that is going to make a significant difference. And many countries across the world have also been seeing an increase in COVID-19 cases, but the difference is that even though most or majority of the population has been vaccinated, they have very low death rates and hospitalization cases. So, I think many people are starting to understand the importance of getting vaccinated as much as people are not forced to get the vaccine, especially here in South Africa, they are, of course, encouraged to understand what a COVID-19 vaccine can do. And many people also arguing that when a population is not vaccinated, and if you just look at what's happening on the African continent with the World Health Organization having a briefing a few days ago saying that Africa is suffering the most now, especially with the Delta variant, because only 1% of the African continent has been vaccinated. If you look at here in South Africa, only 1% of South Africans have been fully vaccinated with Johnson & Johnson and 2 of the Pfizer doses. So there's still a very long way to go. And if you look at how other countries managed to overcome third waves, and when the Delta variant was ravaging their countries, it's vaccinate, vaccinate, vaccinate. What is happening behind me is what government needs to possibly ramp up even further. And we know that those between 35 and 49 years old are able to register as of the 15th, and they will start getting vaccinated from the 1st of August. So there's certainly a desperation for this to be ramped up, and we're seeing this with the private sector coming in and saying we'll operate on weekends to get as many people vaccinated as possible, not just during the week but also on weekends.